of the workshop has been set against the common core principles for supporting people living with dementia. And it's very much a guide that has been developed to ensure that the training of health and social care professionals is relevant to every setting and provides general information around understanding some of the issues around dementia.
The basic principle of Who Issues is it looks at issues from different people's perspectives. And the idea of that is that everybody's got their own wisdom, their own role, and sometimes the light bulb moments can happen just as much by understanding what it's like to be walking in the shoes of somebody who, in this case, has got dementia themselves. The tool is obviously all about the discussions. The game really isn't that important.
It's been a really interesting experience. I mean, we got sort of into the first couple of questions and then realised that we weren't progressing any further because we were just doing too much talking. But that's the whole idea, is it really generates that thinking.
I like to get involved with events like this because people with dementia don't. And the people who come to these events need to have the perspective of somebody who has dementia.
It generates such a buzz, there's so much discussion that's happening, and my job is to capture that discussion visually here on a chart that you can see. They'll be able to retain that information long after this event's happened because they'll have this picture in their head.
I mean, if you're diagnosed with cancer, you go to the clinic, you're diagnosed with cancer, there's a Macmillan nurse there might be a breast nurse there might be somebody else there, you're given a pack of information. Why isn't it the same for dementia or any illness? It should just be there as part of the package and standard.
It's a horrible feeling being on the wrong side of the service delivery. If you're a service deliverer and you're a commissioner or you're a worker in the service, it is a totally different thing being on the outside looking in.
From my experience, people need information and conversation, and they need it at different times and at different points. But they don't want to be dumped with a whole load of information.
Is there anything here that you've heard today that you think, well, I'm going to do something differently? I want you to jot that down on the back of the postcard, and we'll collect all of these in, and then we'll post them back to you in about 6 weeks.
People with dementia know what they want. People who care for them think they know what they want, but they need to talk to the actual patient or the end user to really know and listen. And events like this help it happen.